Welcome to We Can Do Better, a podcast about ending poverty in our time. I'm your host, Fran Quigley. I'm a law professor, and I go to eviction court each week with my students, where we represent millions, some of the millions of people in the United States who are facing the loss of their homes. Many people in our courts and across the country are also forced to skip filling prescriptions, and they often go hungry, despite living in the richest nation in the world. We can do better. Other nations already do far better, and the United States has often done better in the past. So this podcast lifts up the many people and organizations working to make housing, healthcare, and a decent life enforceable human rights for all. So today we are graced with the presence of Catlin Nchako. Catlin is one of the top-notch, part of the members of the top-notch Research and Policy Institute Center on Budget and Policy Priorities. Catlin and his colleagues are documenting the devastating impact of the Trump Republican so-called One Big Beautiful Bill Act. As we'll hear from Catlin, the law has pushed millions of people off of the Supplemental Nutrition Assistance Program, SNAP, also known as food stamps. Catlin works in the Center on Budget's Food Assistance Division as a research associate, where he focuses on data analysis and research for the food stamp, school meals, and the WIC programs. Catlin, welcome, and thank you for joining us at We Can Do Better.
Thank you, Fran. It's a pleasure to be here. Thank you for having me.
No, we appreciate you. So you and your Center on Budget colleagues have some disturbing but really deeply important reporting on the devastating impact on families and people in need of food support that's been caused by last summer's sometimes called H.R. 1, sometimes called the One Big Beautiful Bill Act. Either way, it was pushed by President Trump and congressional Republicans. So before we talk about your findings, can you give us a reminder of what that legislation did regarding eligibility for SNAP benefits?
Sure. So H.R. 1 was enacted July of last year, 2025. And there are a couple different things that it did. So really the biggest thing is that prior to H.R. 1, the cost of operating SNAP, of providing SNAP benefits was fully shouldered by the federal government. The federal government shared the cost of administering SNAP between it and the states, but it paid the full price of providing SNAP benefits. What H.R. 1 did is it basically is making states to shoulder a share of that federal benefits, which is something that they haven't had to do before. It's also asking them to shoulder a slightly higher share of the cost of administering benefits as well. But the big thing is really that they are now responsible for paying for the SNAP benefits that the recipients that state are providing. And that's a big deal, and we can happy to talk a little bit more about why that's a big deal as well.
Sure, thank you.
Mm-hmm.
And there's eligibility restrictions, or at least barriers, and as also were created by the legislation, right?
Yes, that's right. So one of the things that it does is that prior to H.R. 1, there are some categories of immigrants who are lawfully present that are able to access SNAP. So H.R. 1 also restricts those immigrants as well. So if you think of folks like refugees or people who are in need of help, right, for sex trafficking or other reasons that they may need SNAP. So H.R. 1 restricts those categories of people who can access SNAP. The other thing that H.R. 1 does is I'd also add new categories of SNAP recipients to people who, there's a group of SNAP recipients that can get SNAP benefits for a very short amount of time.
Mm-hmm.
They're only limited to 3 months of benefits out of every 3 years. And what HR done is adds new categories of people into that group, including parents with children that are 14 or older, which is a group of categories that were not included in that before.
Right. So by that, if they're only eligible 3 months out of every 12 months, people still need the other 9 months, right? So this can be devastating.
3 months out of
families.
every 3 years.
Okay.
Every 3 years,
wow.
36 months. Yeah.
Okay.
Mm-hmm.
And something that we see a lot with our clients in eviction court and beyond is folks that get caught up in paperwork and red tape, and for a lot of different government programs. But one of the things that was enacted last summer and this applies to Medicaid too, and we'll have a subsequent episode. We're not going to make Catlin talk about Medicaid because he has colleagues who specialize in that, but is work requirements, right? And it sounds like, well, of course we should require people who are supposed to be able to work. Why shouldn't we do that? But it ends up kicking people off the rolls who are eligible, right? How's that been a barrier?
Yeah, so one of the challenges with the requirement that people work is if you think of people who are generally in need of food assistance, these are a group of folks who are vulnerable, they're struggling. 3/4 of SNAP households include someone who include a child, someone who has a disability, or a senior. So these are vulnerable groups of people. And the type of jobs that if you look at data that folks who are in this category are jobs where you have inconsistent schedules or low paying jobs. So they have a need for the supplement that SNAP provides to help them keep food on the table. So having having this really short period of time that they can have benefits out of a 3-year period is really difficult. So now when you add even more people into that group of folks, it becomes you're really making it harder for even more people who need help to get the help that they need.
And your prior research, and your by meaning the center and other organizations' prior research has shown that a lot of people in government programs get kicked off for not complying with the work requirements, even though they are working, or even though they should be exempt, but they just haven't jumped through the right paperwork hoops. This is something that you all warned about last year before this ever passed, right?
Yes, and that's very true. I think part of if you think of for someone who's coming to a SNAP office and applying for benefits or getting recertified, which means that they need to come in and show evidence that they still are eligible for SNAP. So there's a lot of paperwork that goes into that, and that can be quite burdensome for folks who are applying to be able to produce. Say, for example, they have to take time off work to come to the office. If they have children at home, they need to get childcare. There may be transportation issues. So there are a lot of logistical barriers that make it difficult for people who are applying or trying to stay on SNAP to be able to keep getting and demonstrate that they're continue to be eligible. So they can still be working. In fact, for the work requirements, it's not that you there's some base level of working that you still have to do. It's just that you have to be working above a certain threshold. So what we often say is that SNAP recipients do work. The issue is that they're just because of the inconsistency of their job, they just may not be working above the threshold that's required, and that makes it even more difficult given the logistical issues, hurdles that come up.
Right. And I appreciate you talking about the logistical hurdles because as we see, it's hard being poor, right? You don't have good transportation.
Yes.
Oftentimes these are folks with young children, childcare issues. Missing a shift of work can be catastrophic for the family income because it's so tight to begin with. So all those barriers that make it difficult to get food stamps and SNAP is all part of the reason they need SNAP, right? They need the benefits, and so it's a very sad irony that we've made it so much harder for people who already have so many challenges.
Right, and we emphasize that SNAP doesn't. SNAP is still a supplement. It's only if you look at the cost per person per day, it's only about $6 per person which is not enough, to feed yourself or an entire family. So it's just meant as a supplement. So when you take that away, it's even harder. You're just really making it hard for folks who are in need.
Right. And does your data show what we see anecdotally, which is that folks getting SNAP benefits are also needing to get food from other, they're going to pantries and they're going to soup kitchens and they're getting free, trying to just do what they can to get the food on the table because that, as you say, $6 a day is not enough.
Yes, and I think that's what we also work with SNAP advocates on the ground, and from what we hear anecdotally as well, is because it's a supplement, people still need to get other ways to get their food. So they would visit, as you mentioned, they visit food pantry. And what HR does, one of the impacts of HR1 is that because people are losing their access to SNAP benefits, that means that there's going to be an increased need for them to go to food pantries and food banks, which I think also anecdotally there's also concern on that. And while we can't fulfill this level of need, I mean, there's a role for the federal government to come in and actually be a source of assistance for folks in addition to food banks.
Right. And again, you all and your colleagues and have warned about this a year ago, but the legislation passed anyway. And so now we are almost a year later, 11 months later, and you have now on your website, it's cbpp.org, and we'll put the links in the show notes, but something called SNAP Tracker. People are losing food assistance as the Republican mega bill is implemented. And you have the data there for not just the national numbers, but state by state by state, so folks can look up their own individual states. So what are the data showing you 11 months after this took effect?
Yes, so the data that we have is as recent as April of 2026, a little bit lag from today, and that's about 8 months from the passage of HR 1. And what we are seeing is what we were afraid of, is that we see that the number of people on SNAP is declining. So since July, nationally speaking, there's more than 3.5 million people who have lost their SNAP benefits. There's that many fewer people on SNAP. That's
Can we
nearly
stop and just
9%.
underline that for a second? 3.5 million people who were eligible, so therefore they needed food assistance, and now just less than a year after the legislation passed, they are not getting any food assistance.
Yes, that's right.
Wow.
And it's terrible. It's actually terrible. It's really terrible. And we have not seen this sharp a drop in this short a time in SNAP participation in 30 years. So it's really notable, and it's hard.
Right, right.
It's quite hard.
Right, and we just can't ignore the fact that this means kids are going hungry. This means that seniors are going hungry.
Yes.
Families are not able to put food on the table. You again, because you all are experts about this, you understood and anticipated what some possible argument would be back. So, well, maybe people aren't getting SNAP because they don't need SNAP benefits, food stamp benefits anymore. But you also compared to the unemployment data. And what did you find in terms of whether people are off SNAP because they just don't need it anymore versus the fact that they're getting blocked from being on it?
Right. So part of, as you mentioned, the argument is, well, the economy is doing better, and therefore this is why people don't need SNAP anymore. But if you look at the unemployment rate, which is the marker of the economy, the unemployment rate has stayed flat. So it's not actually the case that the economy is doing better, and that's the reason why SNAP participation is going down. So there's other factors that are affecting it. It's not a function of the economy.
Right.
The other thing to add to what we see in the data is that we also look at SNAP participation of children, and we don't have data for all the states, but among the 12 states that we have, we see that out of 12 states, there's about the decline in SNAP participant was about 1.6 million, and we see that the children is about half of that. And that's just children receiving SNAP. So it's really, I mean, again, we're talking about people who are vulnerable children.
Right.
And yeah, it's not a great picture at all.
Right. And that certainly doesn't fit the narrative of, oh, these people just don't want to work. They are children, right? They are children who, of course, we don't expect to put money into the coffers to buy their family's food. That 3.5 million number that you talked about, that's a nearly 1 in 10 people who were getting SNAP before. But in the state of Arizona, and it's somewhat like that in the other states when I look at your website, but the state of Arizona, it's a very different story. And can you tell a little bit about what's going on in Arizona and why that might matter to the folks in the 49 other states and the District of Columbia?
Yeah, so I think I think we think of Arizona as being a sort of a alarm bell for what could happen in other states. And so now, I'll preface by saying that the caseload decline for many states happened before HR 1, but what you see is that the caseload decline is accelerated after July. And in Arizona in particular is very stark because they have seen a 52% drop in their caseload the past 8 months. And if you and that's very stark. I mean, other states, after Arizona, other states, every state has seen a caseload decline. After Arizona, you're seeing declines of over 10% about 13 states. But Arizona in particular is it's a huge drop.
That's startling. More than half the people who were on SNAP a few months ago are no longer on it. And so that kind of leads to the question of, as bad as this is, as disturbing as this is, you've hinted at this, and in your reporting again at cbpp.org talks about it. This could get worse before it gets better, right?
Mm-hmm. Yeah, I think that's certainly our fear. So part of the challenge here is that for state agencies that are administering STEP, now that they have to shoulder this new cost of paying for benefits, they have a limited budget and they have to balance their budget. So if now they're expected to pay this new cost, they have to get the money from somewhere else, or they have to reduce their roles if people are on SNAP, or reduce the amount of benefits, or adopt policies that in effect make it harder for people to stay on SNAP, so they're not protecting SNAP access to SNAP as much. So I think this is sort of the incentive that HR 1 provides, and we think that this is what we see happening in Arizona, and that we think also happening in other states. We already hear anecdotally about how states, in response to HR 1, are they have staffing shortages, so it's already hard for them to keep up with the amount of calls that are coming in, or also that they're also requiring more households to verify their income a lot more, even as they have limited staffing, which makes it administratively more harder for households to keep up with the requirements of staying on SNAP, and then you see this cascade effect of people falling off the rolls because of it. So there's a lot of bad incentives from our point of view for state agencies that result from HR 1, and has a really negative impact on people who need the help.
Right. And I appreciate that, because you circle back to the first thing you talked about with what the legislation did is kicked a lot of the costs and responsibility to the states. And that seems like, well, what do we care? Federal government, state government, they're both going to pay. It's like, no, if state governments are tight on money, one way for them to, like you say, to have this negative incentive to keep their caseloads down, less people getting SNAP benefits, is make it harder to get SNAP benefits. And make it less accessible and more burdensome barriers to apply, and to, as you say, recertification. Any of us who've ever done this work with low-income people, a lot of folks are on benefits or getting some kind of support, but then they keep having to prove themselves, and that paperwork jumps through, especially low-income people oftentimes get evicted or have to move, and then they're not getting the notices that they need to recertify. They miss that, and all of a sudden they don't have the benefits anymore. So as you say, the states have an incentive, and I got to say, in our state of Indiana, red state, they're looking at ways to cut the SNAP enrollment so that it can ease the pressure that puts on the state budget. So this is something you all, again, warned about a year ago. You said this was going to happen. We had lots of politicians saying, oh, don't worry. And unfortunately, we wish you weren't proven right, but you have been proven right. So Catlin, let's say we give those lawmakers the benefit of the doubt, and they sincerely didn't think these horrible things were going to happen, or at least even if they did, now they're disturbed about it, and they have an opportunity to change things. What would be the short-term fix? And then I'll probably follow up and say, what will be the long-term fix, presuming we have a different political landscape at the federal level? But right now, in June of 2026, July of 2026, what could and should Congress do to stop this enormous damage happening?
Yeah, I think what we are seeing in the short term is that we think that Congress should delay this cost shift, meaning that the requirement that states shoulder a higher share of the cost of providing benefits by 2 years. And that would, in the short term, that would give states more time to prepare. One thing that's notable about what we're seeing here is that this decline is happening as states are scrambling to prepare themselves, and this is happening before states have even have to pay. They're not paying yet for this higher cost. This decline is happening prior to any of them being responsible for any cost. So that's very notable in terms of the impact before you're actually seeing them having to pay.
Right.
So we want to delay this. We say,
Okay.
okay, in the short term, Congress should delay this for 2 years and give states more time. And then this also stems a caseload decline that we're seeing in response.
So again, you are part of a nonprofit research and not an advocacy group, so I won't ask you the question about who should be in charge politically. But if there is a different political climate, if the folks can put together a majority of lawmakers at the federal level who are concerned about kids not getting food, what's the long-term fix to this besides just going back to and presumably repealing some of these the most egregious problems? That's I guess step number one, right? Is to stop what happened with HR1.
Yes, we would advocate for a full repeal. I mean, I think HR1 is just very has a very there's a lot of negative impacts, both for people who need help, people who are eligible for SNAP, people who need food assistance, and then for state agencies that are administering SNAP as well. So we plan and advocate for a full repeal from Congress.
Okay. And I will give a little pitch for a future podcast episode. I can tell you from the lawyer perspective, when somebody is not getting food assistance, when they're not getting housing assistance, there's very few legal remedies. We don't have an established human right to food, housing, healthcare in the United States, in large part because we have not signed on to the International Covenant on Economic, Social, and Cultural Rights, which the U.S., in my opinion, I won't put words in Catlin's mouth, in my opinion, we should. And if that happens, maybe we can smooth out this pendulum of when one particular administration or one particular Congress gets in charge and starts slashing the benefits. And then, as Catlin said, maybe in 2 years, maybe in 4 years, maybe we can restore them. But when's that going to happen again? So that's a future podcast episode and future articles, but I will leave it at that. And so let me ask you, Catlin, with the states being this responsibility right now being put onto the states, as you say, it hasn't even taken effect yet, but what can and should states do to prepare for this to happen if it's going to happen? And what can a state that doesn't want to see the kind of numbers that we're seeing in Arizona and the kind of suffering behind the numbers we're seeing in Arizona, what at the state level should advocates do, and what should lawmakers at the state level do?
Yeah, I think for lawmakers, I think for advocates, just continuing to show on the ground what's happening to people who are being affected, like bring up your stories, highlight stories. This is something that has real life consequences. So advocates, I think that sort of real life storytelling beyond the data that you're seeing is really important to both make general public and lawmakers aware of what the impact is. Lawmakers, I think with lawmakers, I think it's the same thing as Congress, where should really be bringing this up and discussing this and really going back to a full repeal of the law. State agencies, I think, have a harder time because they're really sort of hamstrung by the requirements here. I think that there are options that states can do that make the administrative burden on households easier. There are certain policy options that states can adopt. They can not require, for example, SNAP households to certify their eligibility as often, right? So that mitigates some of the administrative burden, both for them and then as well for households. So definitely some policy options that they can do to make it easier. It's a very difficult thing to do in the context of what the law requires.
Well, I appreciate that. And when we talk about it, maybe from the state level, or we talk about it as advocates, there are benefits, and you're a food assistance researcher beyond just SNAP. What are the benefits to the community? Again, hopefully everyone listening to this, hopefully everybody cares if children go hungry, just because morally that's the wrong thing to do. But is there also benefit to the community from these programs ensuring that our neighbors and our kids are well fed?
Yes. So, SNAP is the nation's largest anti-hunger program. And so I think SNAP, for example, there's research that has shown that SNAP helps mitigate food insecurity. When you think about food insecure households, and particularly when you consider households with children, we see often that they're also particularly impacted by food insecurity. Research shows that for children that are hungry, have difficult times paying attention in school,
Hmm.
there are a lot of health benefits to not being hungry. I mean, we know that on a visceral level. And I think that's why SNAP is really important. There's also research that shows that even as SNAP is a supplement, the fact that people are able to use this to help them get food on the table helps raise them a little bit out of poverty as well. And then the other benefit that comes is also that comes to mind is that SNAP also helps the economy. And there's research that shows that for every $1 in SNAP that's spent, that contributes about $1.50 to the economy.
And how does that work with the SNAP benefits of a dollar actually contributing to the economy that way?
Well, I think, for example, if I'm a SNAP recipient and I go into a store that's authorized to accept SNAP benefits and I'm spending money, and then in turn, that allows someone else who's working at the store to have a job, and they're also contributing to the economy. So there are these sort of rollover effects from people spending. Like if you think about the idea of the economy doing better, is that you have people wanting people to spend, and I
Right.
think that's where having SNAP benefits is a contributor to the economy as well.
Sure. And SNAP recipients, I'm sure, are disproportionately spending their money in their own neighborhood and community, right? Because these aren't folks who are
Yes,
unfortunately or fortunately able to spend their money out of state, that type of thing. So this is going to be putting money right back into their neighborhoods.
that's right. That's
And
right.
and we see it a lot in eviction court. Unfortunately, we see people who are losing their housing, and it's usually there's a reason behind it that's not connected directly to housing, and that is that they had to pay for an extra prescription or that they
Hmm.
had some type of emergency with transportation, et cetera. And I assume if folks have a steady, decent amount of SNAP benefits so they can put food on the table, it makes it more likely that they can pay their rent on time and that they can
Yes.
get their health care. And so therefore it's a more stable, healthy household and a more stable, healthy community, right?
Yes, yes, no, yes. And the point this also brings up is we can connect this to jobs as well. I think that I mentioned before that allows the research shows that SNAP recipients are working in jobs that are relatively low income. They have inconsistent schedules.
Hmm.
So in some ways, if if we can improve the economy and jobs for folks, for low-income folks, we also make it easier for them to be able to afford their basic needs, and therefore they have a little bit less of reliability on SNAP. But if that's not going to happen, then you should help people. And I think that's sort of the values that where we're coming from when it comes to why we are advocating for SNAP.
Right. And you're more familiar with it than I am, but I've definitely seen polling. I mean, that like happily, most people want everyone to be fed. Well, happily,
Yes.
most people do not want children and seniors and other folks who are struggling to be hungry. I'd like to ask you a little bit about your own path to this. And I see that you have a master's from Georgetown. You went to Cornell. You went to these fancy schools. I just teach at Indiana University, but I'm honored to be in the same conversation with you. But I'm also really intrigued by the fact you worked in the past as a researcher for the United Food and Commercial Workers Union, which I think, as you say, just ties into the fact that most folks who are in need of SNAP are working, but they're working low income jobs. So, what about wages and food insecurity? What kind of connection have you seen in your research in this job and maybe even previously too?
Yeah, so I think with respect to I work at the labor union, so I worked at the Food and Commercial Workers Union, which represent workers such as folks who work in retail stores and grocery store
Hmm.
workers. So you can think of these jobs as being the jobs. There's certain types of jobs there that would fit into the category of the jobs that some people who might need food assistance would be in those categories of jobs. And I think that part of what as a labor union, what you're fighting for is workers' rights and for people to have a livable wage. And so I think that connects to the work here
Hmm.
because I was saying earlier that you want people, or from my perspective, you want to have an economy and jobs where people are able to live, meet their basic needs, and get and be able to put food on their table, and have all the full workers' right protections. And but if we're in a society that does not allow for that, then it seems cruel to then also then deny them the the food assistance to that need, which is how I connect that to the work that I'm doing
Sure.
now.
Sure. And it, of course, connects to the political theme of H.R. 1 and One Big Beautiful Bill Act in terms of work requirements. We want people to work. Well, of course, and everyone who is able to work wants to work too. They
Yes.
just need a living wage job where they can put food on the table and they can pay their rent. And that's the struggle.
Yes.
Well, I just so much appreciate what you do. I appreciate you taking time out of this unfortunately historic moment that you are in. I do want to commend folks to look at the Center on Budget's website. Right on the front of the website is the SNAP tracker, because that's such a critical issue, but you all do so much other healthcare and housing and subsistence income research. And so it's Center on Budget Policy Priorities, and it's cbpp.org. We'll put links in the show notes. You all are on social media as well, right?
Yes.
And sharing your research and sharing these alerts. And Catlin, anything that I didn't ask you about that you'd like to share with folks before we sign off?
The main thing I would just reemphasize is that there's a real human cost to HR 1, and I think that's the one thing I would want your audience to take away with that, beyond the data and the news reports, there are real life people who are being affected by this. And that's important to keep in mind and to let your members of Congress know about.
I appreciate that. I appreciate both sentiments. Yes, this is real human cost. There's suffering, there's hunger going on right now in our communities because of this. But federal lawmakers caused it. State lawmakers, unfortunately, may be exacerbating it, and they all answer to us. So we need to let them know. So thank you very much, Catlin, for joining us. Thank you to our listeners for joining us today. We will see you next week. And until then, remember, we can do better.
Thank you for having me.